Porn-induced erectile dysfunction. Hi, my name is Luke Vu, clinical psychologist, mental health expert, helping young men overcome digital addiction, depression, and anxiety. Today, we're talking about porn-induced erectile dysfunction and how you can ensure your porn consumption habits don't affect your sex life. Quick disclaimer, I'm not your psych, this isn't treatment, and if you need a psychologist, you should find a registered, qualified psych in your area. So what is porn-induced erectile dysfunction? So this actually isn't a straightforward question because it's not well defined in the literature, and it's still an area that requires research. In its most basic form, it's erectile dysfunction that is related to maladaptive pornography use. So it's not clear if this is caused by excessive consumption of pornography, excessive masturbation, or changes in arousal patterns or preferences. Additionally, there can also be psychological factors such as performance anxiety, existing mental health symptoms, and medical conditions that might underlie the sexual health difficulty. Typically, when someone wants to discuss if their porn has affected their sexual health, it's often in the context of partnered sex. It's because they feel that their partnered sex life has been impacted, and they don't seem to find the same difficulty when consuming pornography. If porn is a reenactment of sex, how can watching simulated sex be more engaging than actual sex? There are a few ways that porn can be more engaging than partnered sex. The first is accessibility. You can jump online at any time to consume porn and masturbate. Just the sheer convenience of online porn means you have more opportunities to engage in sexual self-pleasure. The second is that pornography is a supernormal stimulus that allows us to engage in our fantasies. Pornographic fantasies aren't constrained by reality or negotiating with a partner about preferences and boundaries. It also allows you to explore categories that you might feel too embarrassed or ashamed or inappropriate to introduce into the relationship. The third is control. You are able to increase the intensity or heighten the arousal of your experience by switching tabs, browsing endless videos, and discovering new experiences. I also think for some individuals, partnered sex may create some emotional difficulties, such as anxiety, body image issues, or past trauma, which is why some may prefer solo sex via pornography than working through those issues with their partner. So how does one get from enjoying porn to getting ED? Now, this is where it gets contentious because pornography use doesn't necessarily produce erectile dysfunction on its own. Now, erectile dysfunction can be related to other health conditions, such as cardiovascular disease, obesity, diabetes, and mental health disorders, which is why it's important to have a good relationship with your GP or sexual health physician. So with this in mind, a potential route from porn consumption to ED can involve a combination of the following: gradual changes to arousal patterns and preferences, where changes can accumulate and you find partnered sex less psychologically arousing, desirable, or stimulating. Idiosyncratic and unique adaptations to masturbation. You could be masturbating in a way that may involve excessive intensity or pressure or become adapted to a specific method that makes partnered intercourse understimulating. Negative emotions caused by expectations or anxiety during partnered sex. Sometimes you might find yourself in your own head and not connected with your partner during those intimate moments, and this often leads to impaired sexual functioning. Excessive masturbation prior to partnered sex and the timing of the refractory period, and that's the time after orgasm in which you cannot get sexually aroused. For some, the timing of partnered sex clashes with their own physiological characteristics of their porn consumption. So is there a correlation between porn-induced ED and porn addiction? Now, one isn't necessarily a symptom of the other. So for example, problematic patterns caused by excessive use often come up as impacts on quality of life, being late to work or class and procrastinating because they were up all night consuming pornography. However, their sexual health and relationships can remain unaffected. Others may experience porn-related erectile dysfunction, but their use isn't what they would consider excessive or problematic. It may be related to anxiety or shame and not necessarily a particular addiction. However, it is possible that one can exacerbate the other. So if you use pornography to manage or escape negative emotions, you may get stuck in a vicious cycle, and we call that experiential avoidance. That is, using porn as a crutch to escape negative emotions, such as stress, anxiety, can often lead to worse feelings, such as shame, hopelessness, unproductivity, and more anxiety. The porn consumption pattern may affect sexual function during partnered sex and create additional negative feelings, which lead to further consumption, a vicious cycle. It's also worth noting that pornography addiction isn't specifically defined in either the DSM-5 or ICD-11, which are the diagnostic manuals of mental health disorders used by professionals in my field. There are similar diagnoses, such as hypersexual disorders, compulsive sexual behavior disorders, and fetish disorders, but it's worth highlighting that online pornography addiction is still an active area of research. What are red flags that consumers should watch out for so that their consumption habits don't take the form of porn-induced ED? So 5 things to look out for to ensure that your porn consumption habits don't lead to ED are subtle changes in psychological and physiological arousal patterns, such as changes in interest or sexual functioning, changes in arousal towards partnered sex, changes in stimulation preferences and difficulties with partnered sex, failed attempts to regulate pornography or masturbation patterns that produce negative emotions or distress. So what should I do if I suffer from porn-induced ED? If you're affected by porn-induced ED, here are some early strategies to try. Taking a proactive approach to gently reducing or limiting your porn use, and planning for pornography-free days. To be more mindful about the frequency and intensity of your use, and consider masturbating without visual aids. I hope this shed some light on a less discussed sexual issue that affects more people than you think. And if you found this useful, don't forget to hit subscribe. I'm Luke Vu, be kind, be you, catch you next time.